these large mass vaccination sites. You'll start to see those coming up as early as this week. You'll see many, many more, but these are just 3 sites that will be coming up this week. So this is encouraging, and this is again part of that flywheel. I know it can't go fast enough that all of us should anticipate and expect.
Should anticipate the flywheel.
That last mile for administration. Get it out of the freezer.
Get the administration.
These vaccines. $372 million is the budget that we submitted to the legislature on Friday. This is $372 million for IT upgrades, and we're going to have more on that later this week. Logistics, commodities, the public education campaign, more on that in a moment.
Definitely.
In addition to this, we mentioned on Friday, we anticipate $350 million. We're going to get the details of that and the rules attached to it from the latest stimulus. That's just on vaccines.
Get the money, stimulus.
The money available,
Perfect.
$1.7 billion for testing and for tracing and other supports related to this pandemic, but specifically for vaccines. So that money we want to move. It's building on the existing supports that the legislature has provided us. With gratitude, we extend that support as well from the federal government that was identified not only for the state, but also for counties like LA in particular with direct appropriations. Public education campaign, I mentioned just a moment ago, we're focusing on the key message of safety and efficacy. We're also focusing on this query that we get all the time, which is how much is it going to cost you? It does not cost you.
It doesn't cost you anything, everybody.
Information is private.
It may cost you your life.
And then this encouraging.
It may cost you just your tax money.
They're
really good with spending your tax money. Face covering. Wear the face covering. There's many shots to come.
Proposition we bring into the campaign is meeting people where
the campaign.
More on that right here.
More on that with Gavin Newsom.
Engaged and trusted messenger strategy.
Trusted messenger.
Through previous programs, particularly around the census.
The census. Oh, see, if you participated in the census, guess what?
Bottom-up campaign, and we're partnering with 150 CBOs. These are community-based organizations, non-governmental organizations with philanthropy.
Those guys.
40 ethnic media outlets, 18 different languages.
Ethnic media outlets. Get the propaganda out there. We got to spend it. We got to talk in multiple languages.
Outreach strategies.
Got it. Multiple, comprehensive.
Top down. But with that,
top down.
Let me go to a PSA.
Many PSAs.
That
Got
highlight a little bit of some of the new
just a little bit
on the existing messaging package. We put out many different PSAs.
many. Get ready for your propaganda. Okay.
COVID-19 vaccines have arrived.
They did.
Recommended by California's top medical experts.
The medical experts. Listen, they know more than you.
And will build your immunity against COVID-19.
Immunity.
They will be available at
herd immunity. Herd stupidity.
The COVID-19 vaccine can help protect you and your family. And
they will protect your family.
And remember, keep wearing your mask even after.
Keep wearing your fucking mask. Cheap.
VaccinateAll58.com.
You have 58. Is there 58 states now? What? I don't understand this. We'll jam the rectals up your ass. And that's kind of, if you're stupid too and you speak Spanish, go and get your vaccine. Bandaja, pendejo, vaccinación. Yep, get them all. I understand that in Spanish. There he is. He's Newsom again.
This will complement again a lot of what we've already been doing.
A lot of what they've been doing.
Support the legislature.
Well, the legislature is very good at supporting.
We want to build even more investment into our partnership program with CBOs.
Perfect, the CBOs.
So substantial and significant effort in this space.
A very significant effort.
We hope to be investing over the course of the next number of months. We will look to be supported and advanced with the collaborative spirit that we've already received well over a year with the California legislature and
the legislature again. Perfect. Those guys. When will I get to meet the legislature?
It's been essential in terms of a lot of the creative
essential. It's all very essential.
That has also been advanced throughout this process. A lot of the social media side, not just the more broadcast.
Not just broadcast. It's not a lot of media psyop.
Something that is, well, I don't know, creative, but it's interesting, at least to me, and I'll tell you, it's certainly.
It's very interesting to Gavin Newsom, everyone. Unless just for kids.
Excuse them.
Excuse them.
See more intrigued by this slide.
Yep.
Anything else related to this?
Yep. Here comes the propaganda.
We have 2 gorillas.
2 poor gorillas. They weren't wearing a mask, everyone.
2 that have been tested.
Hold on.
We have another that's symptomatic.
The fucking gorillas.
Currently confirming the source.
They were symptomatic, everyone.
There's some question.
And they
with
had
human
no mask
animal
on.
That's being determined.
They were
and we have to
interacting
respect,
with the
that
people
process and the adjudication of the
on a
facts.
regular
But
basis.
nonetheless,
Between
it's
the
just an area,
glass,
that's long been of concern.
they were in
human
confinement,
to animal
but
transmission,
they got it.
Beloved gorillas, obviously.
He loves gorillas. I love
concerned
gorillas
about
too.
and say
Don't get me
it's
wrong.
best
I
of the
mean,
best.
I feel terrible
They
for the
tested
gorillas.
formally two positive, but 3 are symptomatic.
Fuck.
We are likely to see
Fuck everyone. The fucking goddamn fucking gorillas.
days, but I thought I'd
You better
because,
wear
as I
your
say,
mask,
often to
everyone,
all of
because
you,
the fucking gorillas.
what tends to resonate in my house, I want to
It's
make
resonating
to you,
at Gavin Newsom's house because some gorillas got it. Ig! Get out of the road.
these
You're worth more than these goddamn gorillas, okay?
that,
I just spent $3,000 on you.
and for what it's worth, I'm only joined today by Dr. Galley.
By Dr. Galley.
Yolanda Richardson runs our GovOps.
I was going to look up Dr. Galley and insert photo here, but
logistics
I'll look up that later.
vaccinations as well.
In the
And so,
vaccinations,
we're
well,
happy to answer any questions.
they were going to answer some questions.
Governor Sierra, KGO.
Oh,
Hi, Governor. We've been in touch with the California Board of Registered Nursing, who has been in contact with the state with hopes to allow 30,000 nursing students who have just been trained and certified to administer vaccines to help
Wow.
aid the backlog. And I know
I'm
you,
surprised they don't got
alluded to
tattoo
1,000
artists going to be
other
administering the
efforts that
vaccine,
will be associated with that
everyone.
effort in the coming week. But I was curious if you specifically heard about nursing students, and would you consider that?
Yeah, in fact, enthusiastically.
Of course,
so.
enthusiastically. He
Fire
wants to get
agencies and
everybody to
nursing
jam
schools will
this
be
fucking needle in
essential
your
and
arm.
critical, and we are engaging them in terms of the vaccination protocols moving forward. I want to just
Protocols,
distinguish, I'm going to turn this
everyone.
over to Yolanda and Dr. Galley, talk more.
Turn it
about
over to
those
this guy,
efforts, and I
the
appreciate
bald
the query. I just
motherfucker.
want to distinguish
Turn it over to that guy.
1,000 staff
Wearing the weird
specific to
glasses.
the surge in the ICUs and hospitals.
The surge.
As it relates to the vaccinators and expanding the scope and expanding the practice.
Get
of
the scope out
administration.
there.
That's separate in nursing schools and fire agencies, among many, many others. You saw that list, are being sought to secure that last mile distribution.
The last
and
mile.
administration of the
Get
vaccine. Dr. Galley and Yolanda, perhaps you could
Everybody.
amplify that a little bit more in terms of the status.
I need
of
the
our
vaccine
vaccines.
right now. I think I'm dying. I can't breathe. Come on, Nick.
Yolanda, you may have certainly more updated information,
Come on, Nick.
but throughout this whole pandemic, we've looked to the potential use of our nursing
There's
students,
fucking
as
coyotes
well
out
as
there, eh?
other folks,
They're
some
more
retired
deadly
nurses,
than this
others who have
fucking
been out of practice for
something.
some time, but who might want to lend a hand. So that idea of using the
The
nursing
government,
students,
they're more deadly than the
first came up
government,
as a
Egg,
potential
okay?
resource to support our surge efforts very, very early on, and now with vaccines, seems like a great fit. So I know we're deep into
Excellent.
some of those conversations.
I'm-
Yolanda, you may want to.
I'm gonna pop my collar now.
Large resource. I know.
So there's some
that,
vaccines.
Students in healthcare
Thank
are
God.
eager and interested to give back and
Perfect.
contribute. So this is a perfect way to match
It-
both that
I
experience
just said that.
as well as
Perfect.
a way to support the state in its fight against COVID.
Yep.
Agree, Dr. Galley.
Yeah, I agree wholeheartedly, Dr. Galley. You bald motherfucker.
Firefighters, just as the governor said, all hands on deck to provide as much staffing to the vaccination effort as
Right.
possible.
Right. Get him out of the freezer right now.
Thank you, guys.
Inject right now. This
Hi, Governor.
bald
Last week you
motherfucker.
mentioned that the state was conducting a survey of healthcare workers who were declining the vaccine to
Oh
try
my
to get a
God.
handle on
Those
how
pesky
many people were
fucking
doing
vermin.
that. So has the state completed that, and what have you learned?
What the
And then just to be clear, are we opening the vaccine to tiers 1B and 1C across the board, or at this point is that
We
only
should just
if there are
administer
extra
all the
available
doses
that are risk of
at
going to
once
waste?
to
Yeah,
those
it's the
people.
latter. It's only if, and Dr. Galley can pull that out a little bit more. So the survey was not
Perfect,
just
whatever
about
Dr. Galley
people
says.
that are saying yes or no. It was more comprehensive
or
about
no.
what are the
We
issues on
don't.
the last mile, what are the issues on that last inch as it
It's
relates
whatever
to
Gavin
the
Newsom
vaccine
says.
use. I want to provide this slide. You can take a look. You know, this is interesting.
Thanks,
Just
Gavin.
Some of the preliminary data that's come back.
He's got a
from us.
slide for
Dr. Galley
everyone.
Can talk more about this. At UC, just at the UC system, only 2% of our
The
healthcare
UC,
workers have declined
or they're
from
experts.
receiving a vaccine. This sort of flies
Okay.
in the face of some of the national data that's come out that that's a large percentage of people declining, at least in our system, based upon this current surveying, this information updates.
the surveys.
consistently. That's the case. And
These are
for
all
what it's worth,
telltale.
that,
They might as well be
homes,
truth.
clinics, 81% of
Everyone,
eligible residents
stop
have received
believing
vaccine.
anything you
Over
know
half the staff,
and
has
just
received vaccine.
figure out what a
Gives you
survey
sense of
says.
the
Survey
magnitude,
says
of people that
COVID.
are happy to accept the vaccines and gives you a sense.
They're happy
that,
to do
that
this,
perhaps,
everyone.
we are are
I can't
more
wait.
successful in terms of that.
Can't wait
last
for these
phase
people
than
are so
some,
excited.
had feared. That said,
This doesn't
again,
seem suspicious at all.
Josh can fill in some blanks in terms of that survey and some of the results that have come back.
Right. The results. Wait
Yeah,
for the
Governor,
results.
absolutely. The survey was pretty comprehensive. It reached
was.
out to many of the counties that
That was a comprehensive survey.
work to not just do vaccines, but manage surge, keep up the work with testing and contact tracing. And we learned quite a bit there what the various counties need by way of support.
We did,
Some of this
didn't
here, what are
we?
we hearing about
Right.
different individuals
Yes,
accepting
you
the
little
vaccine, declining,
bullshit.
deferring. We're learning that not just
Fucking
people
bald-looking
decline, but they say they want to wait a
motherfucking
little longer. They want to
shister
see how this
motherfucker.
all comes together. So
Yep.
there's all of that information. Some of the top things that we
Yep.
heard were, additional support on staffing, the things the governor just mentioned around nursing
Exactly.
students, EMTs, paramedics,
Those
others
guys?
who can help
Those
on
guys.
the vaccination front.
Get those guys a fucking
various
needle. Get them a
associations,
needle right
California Medical
now so they can
Association,
just start
Dental
injecting
Association,
people.
Pharmacy Association.
It's
All
immediate.
of these as vital resources to help meet those needs. at
Fucking
the local
vital.
level, the mass vaccine sites to make sure
Masks.
that we're able to get as
Masks,
many people
masks.
vaccinated. I think that what we knew all along
Vaccinations,
was different
everyone.
healthcare settings, different
Get-
counties were going to experience differently, wherein the UCs might have a very low level of declining vaccine among their staff. And their
Fucking
patients.
those
Other
pesky
communities might
motherfuckers
have
again.
higher, rates of
Get the
declination.
gorillas
So
in
working to
there.
get that, not just in one or
The
two
gorillas
spots,
need to
but
be
throughout the
vaccinated,
state
everyone.
Is one of the
They're
key goals.
fucking
and making
carriers.
Sure that we address that effectively, not just through
The
additional
two
resources
gorillas.
to help provide the
They
vaccine,
infected
but the
everyone.
messaging, the PSA campaign, you saw a little bit of it today. I think that goes hand in hand
Yep.
with this concept of making
The
sure
concept.
the message around safety
Everyone,
and
the
efficacy
concept.
go hand
The
in hand.
concept.
The last thing I would say is absolutely our goal is to increase the availability of vaccine to as many Californians as possible. But
Get it
while
into 'em.
making sure that we pay attention to this.
We'll
while
make
they
sure we're paying
have an
attention to
important
things.
responsibility to make sure California's vaccinators do get vaccinated themselves, that we support the 1A.
You gotta
priority
put the
or phase,
fucking mask
and
over
make sure
your
that
face
that, does get
first
taken care of
before you
as
can
we move
save
forward
everyone
into
else on the
other
plane, people.
populations and sectors that are equally at risk and
You know, you've been on a plane. You can't save everyone
Yeah,
unless you
I can
fucking
agree.
inject yourself first. Well, you're gonna save the world, everyone.
Question. Either one that's more philosophical and other that's more technical, so I can ask them at once. Is the state's fine-tuned approach, looking not just at age, but at occupations and other factors, does that have a hand in slowing the process down compared to what we see in other states like Florida and Texas? And
Texas.
one of
They've
the
mentioned
questions that I
Texas.
have is,
Wow.
some of the states
Texas,
have
the new
set up
California.
system for vaccination.
Come to
I'm
Texas.
wondering if that's something in
The
cards
lone
for the
California
going forward,
state.
and when that may be.
Come, so
Dr.
come
Gavin, you
take
wanna
it.
take that?
And they're saying, yes, we will. Don't worry. We're gonna come
Sure.
take your shit, dummy.
So we
What you gonna do?
as we've said, some last
You
week.
dumb motherfucking
the idea
Texans.
that our
I've been to Texas,
tiering and
motherfucker.
phases
You guys
has
are
slowed us
sleeping.
down. We have
You're
certainly
sleeping.
begun to address that, working closely with our providers and our counties to make sure the message that
The
all
message.
individuals in that tier 1A can be vaccinated immediately.
Get
There shouldn't
them
be
fucking-
a
get them
difference between
vaccinated.
the first tier and the third tier in 1A, and then ensuring that counties that have successfully and health providers who have successfully made
There's
an
only gonna
effort
be
and moved
success
through
if we
their
do this
1A
in,
are
like,
able
fucking
to
mass,
begin,
okay?
planning and moving towards the
Planning.
1B. So really trying to communicate both on the level of prioritization and then this ever
Yes.
important issue around enforcement. We've
We
talked
need to
very
get people
clearly
enforced.
about the fact that we don't want people profiting from
Yeah,
use of the vaccine,
that.
selling the vaccine, providing it to the
'Cause
highest
that's what
bidder,
my plan
but
was.
also
I
that
was
we
gonna
can't
get this
afford
vaccine,
with
I
this
was gonna
scarce resource
hoard
to have
it,
any waste. So really
and I was
working
gonna
over
sell
the
it
last
like a
many
fucking-
days, weeks, with our direct partners who are the
Right.
vaccinators, sending the message that we need to make sure that we use what we have in our
Okay.
freezers, that we get them out. That's part of the reason we have the
I think I'm
million
having a
dose
COVID attack right now,
dose
people.
goal.
I had
that
to
we set
walk
last week,
up
and
my
making sure
fucking
that we,
driveway.
really do
Like,
create
these
an
guys better
ability
help
for
me.
a number of our vaccinators to
Will
work through
vaccine
that
help
as quickly
COVID
as
attack
possible.
right now?
We recognize
I'm having a COVID
that
attack 'cause this
the
guy's
focus
talking.
on risk and exposure is an important one. We have plenty of populations, our oldest Californians, who, by virtue of what we've seen over the
Virtue
past 10
signaling?
months, face some of the greatest risk when they do become infected. So
They're
ensuring
definitely
that
a
we stay
fucking
focused
risk,
not
you
just
fuckers.
on those in our general population, but first and foremost on our oldest Californians in
Yep.
congregate care facilities, working with our pharmacy partners and a number of others
Okay.
to make sure that that happens. And then secondly,
God.
focusing on
Thank God you're
exposure. We
stepping
talked
in,
about
government.
from the beginning, the role of the essential workers, those on the front lines of whether it's in our hospital and healthcare facilities,
Yep.
whether it's in our food industry or other key places. that
Yeah,
keep
you're gonna take over the
California
food, too?
Making sure that
Thank God, 'cause I
unavoidable
didn't know how I was
potential
gonna eat
exposure
without you
is
guys.
protected with some vaccine. So
And they're
goal
gonna
of
inject the
making sure
vaccine
that
in the
states
food. Okay,
and our
good.
counties and many others, in fact, clear the way so that we can
God.
get vaccine out as soon as
My
it comes into
COVID attack
state
is
as a
settling
state
down
goal,
now.
and we've made a great deal of progress on that in the last week.
Okay.
Just a reminder, the third leg of that stool.
Oh,
risk
Gavin again.
exposure,
Thank you. He's
equity.
a leader.
Risk exposure equity with
Dear leader.
that age overlay. That's the foundation. Flexibility now. We're in the tier that
Flexibility.
we're currently
We need to
in.
get some yoga
Re-
instructors up in
reminder,
here.
Current focus on vaccination helps
Current
workers,
focus.
residents, and long-term
Focus.
settings.
Everyone
And now
focus.
Flexibility.
Flexibility
That
of the
that
vaccination going in your fucking
Trauma
mouth.
focus, equity, and exposure risk. and age.
Equity.
Now
Everyone
more
needs to be treated
flexibility
equally
within
when
phase
you get this
1B,
vaccine.
tier 1, phase 1B.
Phase one equally. Phase two.
Opportunity to clarify.
Phase two is a secondary thing, but
Karen
that's
Lunar,
equally.
LA Times.
Okay, LA Times?
Governor, in light
Perfect.
of the potential for armed protests at the California Capitol in the coming days, what extra security precautions have you ordered to prepare for that? And then,
How do you feel about this, Gavin?
plan to activate the National
I'm
Guard
very
for
concerned
law enforcement?
about the Capitol building.
We, as needed,
As
the latter,
needed.
and the answer is pretty self-evident for anyone who's been around the Capitol. that
I was
everybody
there
is,
just yesterday.
On, I think, a high alert in terms
High
of
alert.
making sure that
There's some
everybody is
crazy
safe and protected.
motherfuckers out there.
People's free speech
Yep.
can be advanced.
They're protecting
no
it,
violence. And so,
by the way, by
those
censoring
operational
you
decisions
and
are
all the
under
comments
highway
on this
control,
fucking
and I'm happy
this
to,
shit, okay?
encourage them
They're
to
protecting everyone.
detail instead
Okay.
and socialize some of the operational
Socialize, social distance.
appropriately,
Got it.
But I can assure you, you have heightened
Right.
level of security
Heightened.
as it relates to some concerns.
Okay, I'm gonna go to my fucking hunting blind.
Justin Gardner, SF Chronicle.
Okay, yeah.
Thank you, Governor.
down here in my
Governor, this
fucking
was said
shit.
the other day, and I just
I
wanted
have
to
fucking
what is your current
serious shit
stand
here.
on
I'm probably going
impeachment
psycho.
and
I'm gonna be a
invocation of
psychopath.
I'm all for it, but
I
I'm
think I'm gonna be
really
a
right now-
psychopath.
So you got it. So let me just, but I'm trying to get 291 folks in the Department of Defense.
We need to get
Trying
these fucking
get more
motherfuckers
support from
vaccinated.
all levels
Okay?
to bring down. I'm just,
We need to
candid
bring
with you,
down this fucking
I'm
current.
focused on this vaccine distribution.
Definitely.
I'm focused on the surge.
We
I'm trying to
clearly.
drive to get us through
Drive.
this extraordinarily challenging period. And I appreciate that focus, and I support it.
Yeah. Stop.
Clear.
Stop
But that's
distracting
not
us
my
from. Yeah.
focus right now. My
Well, that's not
focus,
his
candidly,
focus.
is on you and your family and your safety
Perfect.
as it relates to issues
I feel so much
associated
safer
with
from
getting us
you,
through this
Gavin
very
Newsom.
challenging
I'm
wave in this pandemic.
personally a
And so
Californian,
that's
like a
where my
native
energy flows
Californian.
right now.
Like I lived here all my fucking life. I feel so much safer now that you exist.
Hey, Governor. Good afternoon. Actually, my question is for Dr. Galley.
Oh, Dr.
Galley,
Galley.
In a press conference last week,
Trust
his
this
wife
bald
indicated
fuck. Okay.
that Los Angeles is at a they're basically at a crippled point in terms of
Oh.
oxygen supplies. Governor Newsom, I believe you ordered more morgue trucks in for the LA County Medical Examiner's
Oh.
Office. Where are we
Is that
sitting
so?
in terms to address that also with the minority populations? I've been trying to get the breakdown.
Those poor
of numbers to
minorities.
see how the
I know how they're
Black
getting
nation,
hit so
Latino,
hard.
and even our own LGBTQ community.
You know,
are
those
being
LGBTQs,
impacted, as
those
well as
guys
what's
are
going
definitely
on in
getting
the
fucked up
background.
from this
Where are we
COVID
actually at with that? Because this is getting a little
bullshit.
scarier in Los
And
Angeles.
not the homeless people. Definitely not them.
Doctor, you want to take that?
Thanks, bro.
Doc, do you want to take
Yeah,
that?
sure.
Because
Thanks,
I
Brady,
don't
for
know
the
what I'm
question,
talking
and
about.
I'll tell you that a lot has come together in the past many days as it
Homeless
relates to
people
oxygen.
live
These are
this whole
many
time.
weeks in the making, working with specific facilities, working along the region.
Right.
Lots of progress in terms of addressing the specific needs of certain facilities, certain hospitals that
Jess,
have a need.
Are you going to address the question
but even more
directly, or are
working
you
on
going to
making sure
completely
oxygen
steer
is
around
available to
this shit?
those who are maybe able to be discharged into the community and go back home with home oxygen. So at 3 levels,
Yeah,
addressing
but we have an
the
oxygen
supply
shortage.
within
Hold up,
the
everybody.
specific hospital system,
They're coming up.
making
It's coming
sure
up.
that the
Oxygen
county
shortage.
broadly has access to
Even though I
additional
just mentioned
oxygen,
it here.
so that if a facility reaches internal disaster from the point of view of oxygen need, that we're able to circumvent that and make sure that they have enough, and then ensuring that
Yeah.
the home oxygen delivery systems that we often rely on, often depend on to support
Often.
people to go
I
home.
depend
that
on it
that
every
isn't
day I go
delayed
and
in
hit the
any way.
oxygen
So all 3 of those
often.
efforts are well underway. A lot of engagement.
Maybe
with
if you want
the Army
fucking
Corps of
people up there
Engineers,
when need oxygen,
identifying
motherfucker.
Specific facilities, not just in LA County, but in Southern California broadly, that could benefit
This
from
guy just
some
looks fucking
improved
weird.
upgrades to their oxygen delivery systems. So all of that is in
Upgrades.
place, and at
You
this
know what
moment,
that means.
the capability to address facility by facility.
We're here to
those needs
upgrade.
is real, working closely with the county and making sure that
Upgrade.
those are addressed. So I think a lot of progress in the last week.
Right.
And some encouraging news.
It's
on
all
that front,
encouraging,
and
sir.
really proud of the
Everything you
work
say
that
is
the teams
very
at the state did
encouraging.
with our local partners,
No
a
matter
lot of
how,
private
what
partners and
level of
federal partners
bullshit,
to make
it
this
happens to
situation
be
better.
super
I'll just
encouraging.
remind folks,
Okay?
we created this oxygen work group many weeks ago to address the issue related to demand. And
An
last
oxygen
week
work
we
group
put
he
out
set up,
a deck
everyone.
of slides socializing some of the improvements we've made in terms of supporting our efforts at the local level and expanding our reach.
Wow, he's only worried about the
nationally in
local
terms of
level, and
getting
then he's
more assets,
expanding
more
nationally.
resources. So these mobile oxygen systems have been leased. We've increased
They
access
leased
to
them
this
out.
home oxygen strategy, which Dr. Galley's talked about.
Yep.
In the past, we've got these response teams, specific oxygen
Super.
response teams down
They're
in the
gonna
LA
go out
region,
and hook you up
we
with some
have these
oxygen.
concentrators that are already deployed. So we laid out
Oxygen
a lot more
concentrators,
details
hear that?
than
That sounds
this
sophisticated.
slide provides, but it gives you a sense of the urgency of
concentrators.
focus in this area. And while things are materially better, that is not shared equally, meaning there are issues.
What's this guy talking about, materially better? I'm sure your life is very well, Gavin Newsom. Everyone else's life is kind of taking a shit. Pour money out of our savings.
Patrick Healy, NBC4.
Yeah, anytime now.
The added capacity of these new large venues like Dodger Stadium and Padres, would you like to move into 1B and some of the lower categories?
Yeah, get them right away.
Before 1A is done. And for
Definitely.
Dr. Galley, if you
Get
could,
those-
comment on the decline in the
Get the
hospitalizations,
secondary,
is that
motherfucker.
due to, in fact, the holiday surge not being as bad as feared, or is it more due to hospitals transferring out the less critical patients? Thank you.
It's the
They're
right
different.
question. And,
How about the prisons
I'll-
transferring
just
out the
'cause you
less
asked the doctor,
critical
I'll let him
prisoners?
answer. I have strong,
How about those
thoughts
motherfuckers?
on
How about
that as
them?
well.
Are you not gonna talk? Oh, okay, I'm sorry.
As it relates to the first part of your question,
Okay.
equity, focus on vaccinating
Equity.
the vaccinated.
Right. Get everybody.
Making sure we're taking care
We're gonna
of
get
our most
everybody
vulnerable
equitably
Facilities
handled.
remains our top priority. We're not abandoning equity. We're not abandoning exposure. We're
No.
not abandoning the issue of risk.
Absolutely not,
We're
Gavin.
abandoning
You're
the
sticking
issue
your guns.
of age.
I like that.
So no is the answer.
You're a straight shooter.
But we
Gavin
can do both. It's
Newsom.
an and, not an or. As we get more vaccines, meaning we get more doses, and we anticipate many more doses.
You
that
need
will allow
many
us with
doses,
the
okay?
flexibility
It's
of
not
the
just
rules that
one.
we put forward,
You're gonna
the
need
ability,
many injections
to provide the
of the
resources
lethal
and
dose
support at these mass
for you to
vaccination
die.
centers that still allow us to maintain that thrust of focus. Dr. Galley, perhaps you
Thrust.
could build on that first
Thrust.
and then answer more
Listen
specifically.
to his fucking
on
adjectives.
the
This
second part of that question.
motherfucking goddamn. He's a wordsmith,
Yeah,
isn't he?
and Governor, you hit it right. The focus on equity, the ability to use these max vaccination
I hear
sites as
equity across the
additional
board
touch
here.
points where people can get vaccinated in these early groups is going to allow us to reach that goal. We want to get out vaccine as quickly as we can in California.
It's weird how
starting
they
with
refer
those
to
who are
as
going to be
one,
in charge
like
of
a
vaccinating the rest of us, making
as
sure that they're protected
vaccine.
and safe on the front lines of the surge, on the
This is
front lines
weird,
of the vaccine
people.
sites, on the front lines of the
You're
testing
not-
centers.
you're
and
not
also
suspicious.
that key focus on,
You need to
really
be-
driven by
go
equity.
take a
We know
nap.
who's sort of shouldered the brunt of this pandemic. We've been
Who
tracking
did?
that in our data for many months, sharing
Wait,
it with
what?
you and making sure that we don't overlook them and do all that we can to engage them in our
I was
vaccine
talking
efforts,
over the bullshit.
while keeping an eye on the ability to move forward into those other phases and
Like
those
a
other
flywheel
tiers so that
that
more
moves
Californians
forward,
can get that reach. So
although it
not
doesn't.
just really focusing on these phases and tiers, but setting up a number of vaccination sites under the excellent, amazing leadership of Secretary Richardson.
Hail.
Working with our local partners. to
Hail
get this set up. I think
Richardson,
that's gonna
everybody.
deliver on this risk exposure.
Guy's
and
name
equity
is
framework that the governor laid
Dixon.
out a
Okay,
moment ago.
Richardson.
As it relates to the hospital numbers, I mean,
He's got the
we
sun
did
in his
know
name.
and expected that if the regional stay-at-home order, certain aspects of our own behaviors, some of the communication about the severity of the situation, that if people made some different
Yeah.
decisions in the last half of December,
Yeah,
that we
blame it
would
on the
begin to
people.
see some
I
flattening
know.
of those hospital numbers. First, it comes with a
I
slight
might as
dip
well
and
shoot
plateau
myself
in the
now.
case
I'm a
numbers,
fucking
and then
dick.
you'll see the hospital numbers, followed later with the ICU numbers,
Yep.
begin to
You
plateau.
will.
That said, we are still
That's it.
concerned that over the last week, we've seen some high case numbers, and those will end up in our hospital, 5-10 days from now. So
Oh, they do?
I don't want to think that we're out of the woods in any
This
measure. We are
arrogant
still
guy is
focused
so-
on the middle of this
he's
month,
so
the end of
condescending.
this month as really peak times for our hospital numbers. But we are grateful and expected, given the choices we made, the policy decisions, that we would see a slight flattening now, buy a little breathing room, get into this period when registry staff are more available, that we're able to bring them into the California healthcare delivery system to meet the needs of patients. And we're beginning to see some of that right now.
So Dr. Galley, and perhaps let me sort of expand on the question and just offer you a chance to
yeah.
illuminate us
Expand
further
on
in the
it.
conversations we have almost hourly.
Let
as it
him
relates to,
talk
are
to
we-
you
the
and tell you
fundamental
what to
question of,
say.
are we experiencing that holiday surge that so many of us feared? Now,
Pretty
we had
soon.
Christmas,
This-
Hanukkah,
this
Christmas.
is the answer, Gavin.
25th Christmas. Now
Yep.
we're getting the
Yep.
second week of
What's the
January.
math on that,
You start
Gavin?
experiencing some of that sign. You've got obviously New Year's. Where are you?
Obviously.
What's your sense of? When should we really start
We-
to see or not
when-
see
when
that surge in
are
terms
you
of
gonna
just
expose the
days
propaganda?
in the upcoming weeks?
Yeah. So if
Yeah.
we look at where California was
Yeah.
on January 5th, which would be sort of right in the middle where
guy's
you'd
taking
expect those admissions
don't
coming in from maybe Christmas gatherings or late Hanukkah gatherings, we saw a pretty
on, those
high
guys?
number of day-over-day net increase in hospital numbers of about 3,500 total admissions. Over the last day or two, we've seen that number come down, 2,500 admissions yesterday. That's a significant difference. Now, I share that trend in part to say, yes, we're hopeful that we're seeing the surge now, and it isn't as significant as we'd anticipated. But we still have a few more days before we can confidently say that it isn't as high as we had
Right.
feared.
Of
But we're
course,
hopeful
they
that
can't be
that-
confident unless it's immediate, like when the numbers normally come out immediately. Normally when you're subjected to the numbers immediately, you believe it when you've been obeying orders, but now suddenly when they don't have any numbers to give you, you just like fucking believe what they're telling you. Like, okay.
That really hand-to-hand work with our counties and our hospitals at the local level is going
This
to
guy
carry us
fucking
through the next
pisses me
couple of
off.
weeks. I absolutely think we're in the early parts
You don't
of
know
that
shit,
holiday surge.
motherfucker.
It looks,
You didn't work with hospitals
encouraging at the
before.
moment, and we'll keep watching the numbers over the
Now all of a
next
sudden you like
The
work
moment,
hand in
emphasis
hand
at
with
the moment, but
hospitals.
this week in so many ways will be determinative, and we look forward to those updates. But I appreciate that additional clarification, Doctor. And again,
I
don't
additionally
want folks to run with
thank you
anything
for
without
that
we really
additional
have
clarification.
the
We'll
benefit
probably
of
cut
all
back
of
to you
these data, all
again.
this data. But I remind
Unless
people just
Gavin, are you done speaking now,
closing out this
Gavin?
question, that the
Right.
Monday data,
Okay.
we always, we really want to see. That's
Sorry
why
to
Dr.
take up all
Galley
your
updates
time,
here on
Gavin.
Tuesday.
I know you're a busy
we'll know a little
man.
bit more as that settles over the
Going on-
weekend data and the
going on your
reporting
things
we're not going to see. As I said,
out
this
there.
week will be profoundly significant in terms
Oh,
of being able to definitively answer that question.
Definitely.
Final question, Vicky Gonzalez, KCRA.
These are
Governor, when
not
it comes to
pre-screened
educational,
questions, I'm sure. These are all just fired from the hip, because when I
yes, some
comment
markets
on these
not
things,
meeting that. Some counties that I've spoken to have seen an increase in complaints of businesses operating when
they've
they
just
shouldn't
turned
be
the comments
operating.
off.
Are
So
you seeing this statewide? And I would imagine
I don't know what that's
concerning, and
about.
realistically, how can you respond to individual
Maybe they got
businesses that are
tired of hearing
continuing to
how
operate?
The vast
Gavin
majority of
Newsom's a
businesses are
woman.
doing the right thing. We had updated you and others a week ago. I'll provide you additional information. Make sure you receive it. You should be receiving it momentarily about the enforcement that we've done over the course of the last
Right.
number of months, and the fact that
It needs to be
through those
enforced.
enforcement
It's so
check-ins,
good,
the
it needs to
alcohol
be
beverage
enforced,
withdrawal,
everyone.
cosmetology and others, the
Such a
overwhelming
good thing.
majority of businesses are doing the right thing and are holding strong
Mm-hmm.
against all of the headwinds in terms of their own economic
Yes.
reality and vulnerabilities.
Yep.
And so
Yep.
we're seeing
When they don't make no
more and
money,
more people
they have to fucking
doing the
obey.
right thing than we are people that
Everyone
are
obey.
simply thumbing their nose. We also see
Right.
that also in terms
Yeah.
of local
Those
enforcement and
motherfuckers.
partnerships
They're
in
just
counties large and small, and
devils.
working with sheriffs up
Right?
and down the state of
They're just
California. But
devils,
there are
people.
areas where there's stubborn pushback, and,
Yep.
and
Pushback.
as those things are called out,
You know,
we are doing
like
direct contacts,
fucking,
and we are enforcing
the bullshit.
those rules and regulations, not just in terms of retail
You
operations.
can't prove shit,
sort
so
of
people
units,
say
but
fucking
also
prove it,
larger
and you can't,
manufacturers
and then you just
up
say
and
they're
down the
just
state.
fucking
And so, we
people
will
that don't
provide you
obey.
that enforcement information as we put out last week for you as well as this last reporting period. Give you a sense
Excellent.
of all the warnings we put out, compliance that was immediate after those warnings, and in those few cases where we
Yeah,
unfortunately
those-
had to move forward.
those
with more
businesses that were
enforcement
open-
action. There are outliers, unquestionably.
Those
and
guys
working
are
with our local
devils,
partners as
you know,
particular
for
schools
providing
and
for their
enforcement.
family.
We try to do our best to address those.
and go in there and
Your
just
questions, thank you all of you for the opportunity.
them
to,
down with a
do this
sickle and
update
hammer.
And to answer those questions, we'll provide that information that we promised to a number of you that asked for it, or
Okay.
provide you more detail and information. We
Yeah.
look forward to tomorrow's update from Dr. Galley, and we look forward to updating you in real
you
time
gotta
over the
go.
course of this week
I
as
see,
it relates
Gavin.
to
You're a very
resources,
busy man.
as it relates to the surge, as it relates to our vaccination efforts, and
Yes.
of course, all of our efforts.
Of course, all those
to
people.
work through this very challenging economic period, particularly for our small businesses.
Yes,
up and down the
that's
state.
exactly what it's
Look
about,
forward to,
Gavin. That's
reconvening
ironic
very,
that you
very
point that out. Fucking dumb motherfucker.